The first story was crazy. Okay, so there's 5 medical students that rotate through like obstetrics and gynecology, and this is my first rotation ever, like the first rotation of med school, the first time I'm ever going to see patients, the first time I'm interacting kind of in a normal hospital, right? So we go to this hospital, and this is a pretty big hospital. So I get there, and the 5 of us, we're all in kind of some scrubs, some are wearing business clothing, and we're walking through the hospital, and we finally get to kind of the ob-gyn area. So there are 2 of us that are going to be on obstetrics this week, so there's another medical student with obstetrics to me, and we're all walking through, we all have our backpacks, our white coats on, you know, we feel pretty cool, but we're all really, really nervous. It's about 7 o'clock in the morning, and we're just kind of trying to get introduced to our residents and our attending physicians and the intern we're going to be working with. And I remember we're walking through with this lady who's leading us through. She's like an administrative assistant. She's really great, really nice lady. And we see this doctor come running through the room, and the doctor says, and she's a resident, and she says, "Which one of you guys are OB? Which one of you guys are OB?" And me and the other person I'm working with, I'm going to call him Fred. So me and Fred are working together on OB, and we've got our backpacks on and our white coat on, and we're like, it's us. And she's like, "I've got a C-section going on in OR number 2. Come on, we're going to go see the C-section. Who's scrubbing in?" And we're like, ah. So we figured out that one of us is going to scrub in and one of us is going to watch. So we go into this room, a C-section is about to happen, and we see literally the first 5 minutes of walking into a hospital, we see a cesarean section happen, and it's amazing. It was really cool, but I was so stressed out. I was so freaked out because I was like, what am I going to do? I haven't even learned how to suture yet or tie knots or what's going on. And then they bring us in, and I'm standing there and I'm getting in everyone's way, but I see kind of this really cool thing happen. And about like 30-40 minutes after the surgery starts, they just pull out this baby, a bunch of gushing fluid comes out. Good, it doesn't matter, it's just kind of part of the normal fluid that surrounds the body in the amniotic sac and stuff like that, so it was all okay. But I'm just standing there like this, oh my god, oh my god, oh my god. And usually like blood and guts and that kind of stuff doesn't really affect me because I was an EMT for a little bit, and I always remember that as long as you're like in the zone of trying to help someone or trying to figure something out, the blood and guts don't really mess me up. And they didn't mess me up there. I was completely fine, but I was worried. I didn't know how it was going to be when I saw like a first time like someone was alive and like that. So that happens. I step outside, I take a deep breath, and I put my bag down and stuff like that. And I sit down at a table. I start to like learn about Epic. I'm introducing myself to the residents and the interns and the nurses, who are all amazing, really, really nice people who really care about their job and really care about their patients, and they're really, really lovely people. So the next thing that happens is we're standing on these little stand-up desks, because the whole thing in med school, right, is you're never going to have a seat. I didn't have a seat that week, but that's okay, it's fine. You kind of just stand on the outside waiting for things to happen. So the way this place is set up is there's a nursing station on one side, and then there's this really long kind of hallway, and then on each sides of the hallway there's different rooms for kind of labor and delivery. And where I am on this kind of obstetrics wing is where people are when they're about to go into labor and they're about to go into delivery. So beforehand, they're kind of in another section. Maybe they're being triaged. Maybe they're in another part of the hospital. But once they're kind of getting close, once they're ready to pop, they are brought into our section of the, well, not my section of the hospital, but the obstetrics wing of the hospital. So anyway, I'm standing in this side table thing, and it happens again. They're like, "We have another C-section. Who wants to go in?" So I'm like, and this time I'm scrubbing in. So this time I'm going to be kind of on the patient, my hands are going to be on the patient doing things and stuff like that. Nothing dramatic, obviously, because I'm just starting out, but I'll be actually doing stuff. So I put on these scrub things around my feet to cover my shoes. I put on a hat. And this is the first time also that I'm scrubbing in. So when you scrub in, you have to pick your fingernails, take a sponge and scrub like 10 times on each side, your fingers all around. And you have to make sure when you're doing it also that your hands stay away from your scrubs, right? Because your scrubs aren't sterile. Once you clean your hands and you clean all your arms and stuff like that, this stuff has just been around the hospital the whole time. So you have to make sure your hands are out like this, and otherwise when you go like that, you're not sterile anymore, so you have to re-scrub, re-wash it, the whole thing. The other thing is you have to keep your hands kind of above hip level, because if your hands go below hip level, then all that junky stuff that might be up here maybe it's some water or something like that, may drip down onto your hands and then you're not sterile again. So you have to keep your hands up, you have to keep them away from your body. It was described nicely to me like a fighting stance. Anyway, so I'm scrubbing for the first time, I don't really know what I'm doing, I'm making sure I get my nails, all that good stuff, and then I go up, and then I walk into the room, and there's a big table in the middle, the patient's already laying down, they have the epidural in their back, which is kind of numbing them from the hips down, because they're about to have surgery there, right, or kind of from the midline down. And then there's a bunch of people in the room. There's an anesthesiologist, a baby nurse, a couple nurses. The resident is on one side of the table, or the intern's on one side of the table, and then you have the attending physician that's kind of monitoring the surgery, making sure everything's going away. And then there's the kind of technical scrub tech nurse that's going to make sure basically that the resident and everything that they are get the right piece of equipment, the right piece of gear, the right scissors, all that kind of good stuff. So I'm standing there like this, my hands are up like this, there's a million things going around me, and I'm like, what do I do, what do I do, what do I do? And luckily there was this lovely lady, I'm going to call her Jessica, and Jessica was kind of the scrub person, the scrubbing nurse who was helping me out, and she's like, okay, just stick your hands through this gown, and then you're going to put your hands through the gloves here, don't touch anything, keep your hands up, and then you do another set of gloves, you do a set of blue gloves, again, I think it depends on where you are, but you do a set of like one colored gloves on one side, and then the next colored gloves are different. That way, if you cut through a set of gloves, you'll see kind of the under set of gloves there, which is kind of a marker. So anyway, I have everything. They tie me in the back. You have to do a little spin around to make sure you tie everything, and then I'm there. I put my hands on the patient's legs. The attending physician and the resident are standing at the top of the table, and then they kind of go through this checklist, and then they cut into the patient. They cut straight into the patient. And they go through the abdominal fat, you see kind of the blood, then they go through the fascia, then they go through the muscle, then they go through more fascia, and then you're at this kind of round, kind of circular thing that almost looks like the one part of the heart, but it's the uterus, and it's the uterus filled with a baby. So there's a uterus filled with the baby here, and the attending physician, keep in mind I've done nothing so far, this is my first week of doing anything, she's like, stick your hand inside the patient and just feel around there. I'm like, what? She's like, just stick your hand in the patient. So my hand starts to disappear into this person's literal body. It's so warm. The first thing that I remember is just it's warm. It's so warm. When you're in the anatomy lab and you're kind of on these bodies that are already dead, they're cold. But I noticed that it's so warm. My hands are really warm. And I go about elbow deep into this person's body, and I'm just feeling the uterus, kind of feeling above that are the intestines, below it, kind of on the underside of the bladder, surrounded by all this kind of, normal kind of stuff. And it was amazing. And then I pull my hand out, they feel for where the head is, so they're not cutting into that. And then they start to cut through the uterus very slowly, very slowly. And then they see the baby, and they pop the baby out, all the fluid comes rushing out. It's a little bit of blood, but mostly amniotic fluid, luckily. And then the rest of the time, which is the most part of the surgery, is kind of sealing everything back up. They wanted to make sure there was no bleeding going on. They wanted to make sure they didn't cut in the wrong place. They wanted to make sure all parts of the placenta and stuff like that were out, and that mom was doing okay, right? Baby's already taken off. The cord is already cut, and she's off kind of with the neonatologist kind of making sure everything is okay in the side room. And then you're just standing there and you're just kind of watching. I got to pull the clamp down a little bit. Maybe I'd cut a suture, because what they would do is they'd tie a suture off, and then they're like, cut this, and then maybe I'd push something aside. But yeah, it was really cool. And you can see kind of as they trust you more, they're going to let you do more things. So maybe they'll suction. Later in that week, they actually let me sew together some of the abdominal fat, and then later in that week, they let me kind of try to suture part of the skin on top of the cesarean section, the C-section, which is low, and it was a low transverse cesarean section. And those sutures are a little bit more difficult, and it takes me a really long time because my kind of dexterity with this pincer kind of that you're holding the suture with, the suture needle, and then this other pincer which are kind of holding the skin and where you want to go with, and then you have to undo the pin. It's this whole thing. But it was amazing, an amazing week. So I think this week I kind of saw, God, I don't know, I probably saw about 13 babies be delivered. I delivered one baby. I delivered one placenta, which was amazing. I'm so happy I got to deliver a baby. I wasn't sure if I'd be able to do that. And the big thing is don't drop the baby, right? I didn't drop the baby. And but yeah, I sat in on so many cesarean sections. I got to see one breech delivery. I got to see a twin delivery. And then my favorite part, actually, so the surgery is really cool, actually, because you're sitting there and you're helping, and you're kind of this close-knit team, which feels really good. You talk about other stuff, too, when there's not that much about the patient that you're worried about. but you're this close-knit team, and it's really nice. And it's the other thing I noticed is that I get really sweaty because they keep the room warm for the baby and mom, right? And you're in all this gear, you got double set of everything on, so it's just like you're a little bit hot. But the really cool part of the morning is kind of annoying because you have to wake up really early. I'd get to the hospital the next day at around 5 a.m. to go pre-round and like kind of check up on these patients that we did surgery on or delivered a baby. But I really like that. You have to wake them up, which sometimes they don't like so much, but usually they're really understanding. They're like, I'm like, hey, I'm a medical student, I'm really sorry to wake you up, but I have to check on blah, 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 blah. And then you get to do a full physical exam. I get to listen to their heart, listen to their lungs, palpate their abdomen, push on their abdomen, listen to their abdomen, kind of check maybe to see if the area around where they got their C-section is looking okay, talk to them, see baby there, maybe see 2 babies there. And it was great. And then I relayed that information back to the people that were kind of holding down the fort, the intern and the physician. But it was an amazing week. I thought this week I'd be able to write maybe a few episodes on YouTube, edit a few episodes, send a couple emails, work out. I just had no chance. I had no time to do anything other than eat and sleep. I would come home, I would eat food, and I would fall asleep. I'd wake up at 3:30 to get there for 4:45 to 5, pre-round on the patients from like 5 to 6, start typing up a note from 6 to 7, and then they'd hand off to kind of the next team, because there's the night shift, right, and then there's the day shift. But it was amazing. It was really, really great. And this is just the first week of my first rotation in med school ever. But it's so much better than sitting down and studying. I like the sitting down and studying. I love Anki, as you all know, but it's so nice to kind of just see, oh, this stuff is actually for a reason. But yeah, I don't even know if I'm going to use this video. I just wanted to make sure I remember this week because it was such a cool week.